I don't know how much of this stuff we're going to get through in class, but I thought that I would go ahead and basically make a video of the rest of this PowerPoint. So here we go with this. Fungus. Sometimes these are referred to as mycoses. Can take several different forms. You've probably heard of people having a yeast infection. Molds, you typically don't have mold growing in your body, although it is possible for mold spores to get into your lungs, for example, and maybe take hold and cause a fungal infection there. Fungus is actually kind of a primitive vegetable. Some can actually live inside the human body, but most, of course, are pretty harmless, except for poison mushrooms. Don't eat those. Fungi generally do reproduce by spreading spores. They spread them. You'll notice that a lot of times if you have mushrooms in your yard, you'll notice that they're kind of spreading in a ring that gets bigger and bigger. That's because they keep casting spores out, and if the conditions are right, then the spores can take hold and they can grow. Of course, most of the time, if spores land on like dry ground or out on the road or something like that, then they don't do anything. The conditions aren't right, and so they can't grow. And that generally is the case in the human body. The spores they might get into your body, like if you're breathing, but that's as far as it goes. Your body just basically rejects those cells and throws them out. There we go. Okay, the other thing I wanted to mention about fungal infections is, and this is something you have to be careful of, whenever you're taking antibiotics, like say you get some bacterial infection and you're taking antibiotics for it, then taking antibiotics can actually make you more susceptible to a fungus infection. So for example, you might have like fungus under your toenails or something like that. And if you're taking antibiotics, then it can cause a flare-up. Or sometimes people will have a yeast infection like secondary to taking the antibiotics. Fungi, can be very hard to kill. Sometimes people get like a fungus up under their fingernails or toenails, and it can be darn near impossible to get rid of. Sometimes it takes, maybe even months of medication. Okay, here's some more fungi information. Macroscopic just means these things are big. In other words, we can see them with the naked eye. Mushrooms, stuff like that. And molds. A lot of times there's like a big patch of mold on the wall. Obviously, you can see that. But molds can also be microscopic, and yeast are always microscopic. Now, yeast are bad if they're in your body because they can cause like really painful, irritating infections. But yeast can also come in handy because we use them to make beer and cook bread. This business about eukaryotic, this just means that these are cells that have a nucleus. Some bacteria, maybe all bacteria, don't have a nucleus. They're just a kind of a weird cell that's able to survive without one. Pathogenic fungi, pathogenic are ones that cause disease, and they typically have the ability to grow in different forms. Single-celled organisms are referred to as yeasts, and then the filamentous hypha, those are mold, and they have like a tree branch appearance, which of course you wouldn't be able to see except on a microscope. Okay, here's some diseases caused by fungi. Superficial infections it can look just like a rash. Cutaneous infection is down into the top layers of the skin, and ringworm is an example. Subcutaneous infections, trauma like a cut or something like that, can introduce fungus like deeper down into your skin. And a systemic fungal infection where the fungi are actually in your bloodstream, that can actually wind up killing you. And here's an example of a superficial fungus. This probably is ringworm that's just been allowed to get way out of control. An athlete's foot can be nasty if you don't take care of it. But there's over-the-counter medications available, but sometimes people that are like really old or demented or whatever, they might not realize that they even have an infection unless somebody just happens to look down there and see it. Here's another example of ringworm, and this one is pretty small. This is like looking at it through a magnifying glass. But if it's not treated, it will get bigger. It'll just keep forming like larger and larger concentric rings. Okay, here's somebody that is way far gone with subcutaneous fungal infection. It's like, how did this thing get so bad? I don't know. Maybe they were putting medicine on it, and the medicine do didn't really do much to help her. Anyways, yeah. So this lady cut herself, and next thing you know, she's got infection that's going pretty crazy there, and it says she took 4 months of treatment to get this under control. Okay, this is kind of interesting. Heart valves can actually be susceptible to fungal infections. And fungal infections can get into the bone also. In that case, they would cause osteomyelitis. Okay, protozoas are pretty interesting. These are little single-celled organisms. They're considered parasites. It turns out that these things are really, really dangerous. Now, in the United States, we don't really have that much of a problem with it, but in other countries, it is amazing how many countries don't really have any like water purification process. They just drink out of, out of a lake or stream or wherever they can get some water, and so they're constantly getting sick with these parasitic diseases. And malaria. A lot of times we think of malaria as being bacteria, but it really isn't. It's a protozoan parasite that's very, very popular in the tropics. These things are also eukaryotes. They have a membrane and they have a nucleus. And just quickly, a couple of diseases here. Malaria, I'm not really going to go into a whole lot about this. Main thing is, like around here, it's not going to be an issue. If you were to go to South America, then it might be. So you would take medications. It turns out you can take quinine, and that will help take care of any malaria you have. Basically, just stay away from mosquitoes. Ooh, by the way, did you know that people that have sickle cell disease are immune to malaria? They can walk right through a swamp and never get it at all. This Giardia, this is a water and foodborne protozoan. Basically, this is kind of like, what do you call it, food poisoning. If you get this Giardia in your food, and it can cause some severe abdominal pain, but it can be pretty easily treated. We have medications to take care of that. And toxoplasmosis. Cats have this in their intestines, and what winds up happening is, like, if you have a cat and the cat is using a cat box and you're cleaning the cat box, then you could get this toxoplasmosis in your body and wind up getting sick from that. Okay, an encounter. An encounter just means that your body's been exposed to a microorganism. The entry means how'd the microorganism get in our body. A lot of times, if bacteria get on your skin, they can't penetrate, but they can get in if there's a cut. They can also be swallowed, breathed in, a lot of different ways. Spread of disease. If you're walking around and you're sick and you don't know it, of course you can be coughing and spreading disease as you go. Drinking after other people is probably not a good idea. If you just like pick up a bottle of water that you don't know whose it belongs to and you start drinking, then that's another way that diseases can spread. The bottle would be a fomite as opposed to a vector. A vector is anything that carries a disease that's alive. So like if there's a deer running around with rabies biting people, then the deer is a vector. Multiplication, microorganisms, most of the time they get in your body, the immune system kills them, but if they do get a chance to replicate and multiply, then they can start getting out of control pretty fast. Various kinds of damage microbes can cause. A lot of times, like viruses, will get into cells and basically burn them up. They use them as a replicating factory until the cell is just exhausted and dies. Outcome. You either get well or something happens, you get really sick. Now, chain of infection, and we're talking about in people here. We have to have 4 factors in order for a disease to spread. We need a host, we need the organism itself, mode of transportation, and reservoir. Okay, the human host, there's all kinds of diseases that humans can get It turns out, what is that old saying about like the human mouth is dirtier than a dog's mouth? And infectious microorganisms can take the form of bacteria, virus, fungi, or protozoans. Modes of transmission. Endogenous infection. That means that like the disease has been introduced down into the body. Overgrowth of normal body flora is transported to a different area of the body. Exogenous infection means transmission from outside the body. It's not your normal bacteria that you have. And that can be direct. Direct contact's kind of self-explanatory. If you touch somebody that's sick, then you can get sick. Vectors include things like mosquitoes and fleas, any kind of animal, like a raccoon or something. Any kind of animal can be a vector. If it has a disease that a human can catch, then that's what it's considered. Now, fomite is kind of like a vector, but except for it's not alive. So, like we were talking about, if you see a plate laying there with some food on it, and you pick up the fork and start eating, and the person that was eating before you was sick, well, then you can get yourself sick. And if also you forget to clean the room, like if you forget to clean the room between patients, then the table, the x-ray tube, the upright chest stand, those can all be fomites. And the reservoir. This is a place where the infectious organism can basically hide out until it's reproduced enough to really manifest itself. And this could be anywhere in your body. Now, if a person is walking around with a disease in their body and they're not necessarily manifesting symptoms, then they're referred to as a carrier. So they could be like patient zero. Maybe they got sick and then they got better, but they've still got the disease in their body. And a good example that I'm going to show you guys is Typhoid Mary. And of course, animals, insects, they can all act as reservoirs / vectors. Okay, Typhoid Mary was an interesting case. This lady, Mary Malone, I think this was back in the 1800s. She had salmonella. This is the disease that causes typhoid fever, but I think she had it, and then she got better, but she still had the active disease, I think it was a bacteria, in her body. And she worked as a cook. And so here was this lady cooking food, and she was just poisoning people right and left. And she promised not to cook anymore if they would let her out of jail. So they let her out of jail, and she changed her name and got a job in a restaurant cooking and caused yet another outbreak. So finally they said, look, this lady is too dangerous to let walk around. So they put her back in jail for the rest of her life. She wouldn't stop poisoning folks. Okay, hospital-acquired infections, about 5%, and I think that number may actually be low. I need to go back and check that again. Anyways, hospital patients tend to get nosocomial infections. In other words, they were sick when they came into the hospital, but they might not have had MRSA or VRE or whatever, but they picked that up while they were in there. Now, some diseases that people get in the hospital are, not necessarily deadly. Like a UTI is a pain in the butt, but it's pretty easily cured. It's not going to kill you. Whereas if people are immunocompromised and they pick up pneumonia, that certainly can kill them. Now, nosocomial and iatrogenic are different. An iatrogenic infection or an iatrogenic disease is something that is brought about by the treatment you were receiving from your doctor. So, for example, if your doctor gives you a medication, like a really, really strong medication, and it winds up injuring your liver, well, then that's an iatrogenic disease. Okay, immunosuppressed patients are the worst for getting diseases in the hospital. So just in case anybody was to ask you that on a test, that's your answer. There's lots of sources of disease in the hospital. And why? Well, because everybody in there is sick. Medical personnel aren't necessarily sick, but if they don't do a good job of hand washing, then they can spread disease all around the hospital. And of course, there can be contaminated instruments, equipment. If we're not careful, if we don't keep everything clean, then we can wind up spreading disease from one patient to another. And we're doing invasive procedures. We're putting catheters in people, we're sticking them with needles. People are going to the operating room and they're getting cut open. These are all opportunities for infection. And here's just a little pie chart of different types of hospital-acquired, aka nosocomial infections. And you can see urinary tract issue is really the big one. And then we have surgical site infections. People have surgery and then the surgery gets infected. People get infections in their blood. And then people wind up getting pneumonia. Now you'll notice not that many people, only 13% wind up getting pneumonia. But a lot of times the people that get pneumonia are, they were really sick and their immune system suppressed. So it winds up killing them. And interestingly, sometimes people come into the hospital for surgery and the surgery goes pretty good, but then they wind up dying of pneumonia. Okay, body's defense mechanism. Mechanical, we have a skin that is basically impervious to bacteria. We're constantly shedding skin cells. We have sweat and oil on our skin that is pretty hostile to bacteria. It makes it really hard for them to take hold, just on the surface of the skin. And then chemically, we have mucous membranes that help trap foreign particles and sweep them out of the body. And then at the cellular level, we have white blood cells that help destroy foreign, invading bacteria and things like that. Normal flora is like your E. coli that live in your intestine. There's also bacteria that live in your mouth and your nasal passages, and you have kind of like a symbiotic relationship with those. And they can actually help you fight off other diseases that don't belong there. And I know y'all have heard of chemotherapy and immunization. Chemotherapy is basically using poison to try to kill disease out of your body. We want to poison the patient so that we kill the disease without killing them, if that makes any sense. That's why people that take chemotherapy, a lot of times they are very, very sick. It's because, the drugs that they're taking are super strong. Immunization, you guys have all had your immunizations. We're hoping that if we give somebody like dead, like a disease that's been rendered impotent, then we can inject that in a patient and it'll help build up their immune system so that when they see that disease again or one similar, then they'll be able to fight it off. Environmental control. Basically, there's several different operations here or different outfits that kind of watch what we're doing as a hospital. And it's almost like, how you go to a restaurant and they've got a rating on the wall and it says like 95% or something like that, how clean the place is. Well, all these different, like the CDC and OSHA, they have certain targets that we have to meet as far as cleanliness and infectious disease. Like if all of a sudden a bunch of people start getting sick at the hospital, well, then the Department of Health and Human Resources is going to start having some serious questions. What are y'all doing over there and what can be done to fix it? Personal hygiene, very important. This is why we're always harping on you guys. Short fingernails, keep your jewelry to a minimum because believe it or not, if you have like elaborate necklaces and earrings, that can actually wind up being a place where disease can take hold. So your silver filigree necklace could actually wind up being a fomite. Definitely you want to wash your uniforms. Every time you leave the hospital, make sure that uniform gets washed and clean off your shoes from time to time. Take like some wipes or just like some disinfecting cleaner like Lysol or something like that and clean your shoes so that you don't be tracking disease around. Keep your hair short, keep it pulled back. Don't let your hair dangle down onto an infected patient. And then asepsis. We've kind of talked about this already, so I'm going to just breeze through this. Medical asepsis is like washing your hands, cleaning up the exam room. basically just trying to keep everything as clean as possible. Surgical asepsis is a little different. In surgical asepsis, we actually have areas of the room that are sterile, and we try really, really hard to make sure that nothing contaminated ever comes in contact with those surfaces. That's very important that we keep the patient from getting infected whenever they come into the operating room. And then there's also some procedures we do, like lumbar puncture, myelograms, arthrograms, HSGs. Those have to be performed under sterile conditions also, because we don't want to infect our patient. And sterilization is the killing of all life forms. So if I have like a knife and I want to sterilize that thing, then I need to put it in a device like an autoclave, and that will basically steam clean it and make sure that all the germs and viruses are killed. Now, medical asepsis, we use disinfectants. We can use chlorine, alcohol, other chemicals, to clean our equipment with, clean our tables, mop our floors. Antiseptics are used to kill microorganisms on body surfaces. So something like alcohol, hydrogen peroxide, or iodine, those iodine compounds, betadine, that's all antiseptics that are used to kill microorganisms prior to doing a procedure on a patient. Okay, hand washing we've talked about already, but I want you to remember this because you'll see it on tests over and over again. Hand washing is the single best way to prevent the spread of infection. It works, and it's easy. Surgical asepsis, and I told you guys about the autoclave already. This uses moist heat at near the, like the boiling point of water. It's very, very hot, and it kills all germs as far as we know, and viruses too. Okay, standard precautions. The CDC came up with these standard precautions because people were coming into the hospital and they were getting like cross-contaminated due to personnel not being careful. So they said, okay, universal precautions. From now on, every patient, whether they look sick or not, we're going to wear gloves. And if somebody looks like they've got a cough or a cold, we're going to put on a mask. And if somebody's got an open wound and there's blood, it's bloody or it's got like pus leaking out of it, then we're going to put on a gown. And if we think that they're going to cough into our face, then we might even put on like a face shield. Or if we're going to be in surgery and there's going to be blood spraying, we would put on a face shield or some goggles. These are all considered standard precautions. Okay, some stuff that we have to worry about. Now, HIV and AIDS, the only time you're going to have to worry about this is if a patient was to cough phlegm or blood and it like went in your nose or your eyes or, heaven forbid, into your mouth, then it's possible for you to contract HIV. Hepatitis. Hepatitis is transmitted by contact. So if a patient has this disease and they're bleeding or have some other kind of body fluids on them, you don't want to touch that with your bare hands. Sometimes what winds up happening is healthcare workers will touch the patient and then scratch their nose or rub their eye or something like that, and then they can possibly, pick up hepatitis. Now, tuberculosis is airborne. It does not need a droplet to survive on, and so this can easily be transmitted through the air, and if you inhale it, then tuberculosis can take hold in your lungs, and if left untreated, eventually it will kill you. It's a deadly disease. We can cure it, though. It just takes a while. I think it's like an 8-week regimen of antibiotics. Okay, so anyways, threat of exposure to these diseases led to the establishment of these guidelines. Here's some other bodily substances that may be infectious. Any kind of secretions, breast milk, CSF, synovial fluid, basically any kind of fluid that comes off of a patient can be infected. And then, of course, urine, fecal matter, C. diff can be in feces. That's really nasty. Nasal secretions, sputum, like if somebody's got a really juicy cough and they're coughing up a lot of phlegm. Open wounds, if there's like lymphatic fluid or blood draining from an open wound. But what can we do about all this? Well, we can wash our hands, we can put on gloves, use your PPE, gloves, gowns, face masks. Do not recap use needles. If that needle has got blood on it and you stick it in your finger, then you can wind up getting contaminated. And actually, if that happens, we're supposed to write up an incident report. That's considered a sentinel event. Biohazardous spills, anything that spills off onto the floor or onto the table, like diarrhea or anything really, that needs to be cleaned up, and it's got to be cleaned up using a bleach solution. You might have to call housekeeping to help you. Gloves. Anytime you've got a patient that looks juicy, put on gloves. I know at a lot of our outpatient clinics, we don't necessarily use gloves for every patient, but it certainly is not a bad idea at all. Here's a video you can look at if you get a chance. Use of PPE, goggles, mask, eye protection, anytime there's a chance, like especially like I was talking about in surgery, if the doctor is using like a bone saw or something like that, then little particles of flesh can be flying through the air, and they might even almost be too small to see. And if you're in endoscopy, then same kind of deal. The doctor's got an endoscope down the patient's throat or up their rectum. There's definitely a possibility of droplets being released, kind of getting slung around. Mouthpieces, you should not do mouth-to-mouth resuscitation. There's ambu bags available at the hospital. Always use those. If you do have to perform rescue breathing, use a plastic barrier device. Those are available at the hospital also. And you guys know how to put on gowns. We use those cheap plastic ones. Use them one time, throw them away. Needle recapping, don't do it. Just take your needle and put it into the sharps container. Spills, we have almost like cat litter that we can use to get spills up. So ask for that if you need it. And isolation. Some of our patients are in isolation. Reason being, they've got something really, really contagious. And so when you go into an isolation room, be super careful. Gloves, mask, and gowns, always. And like if you're on portables, do your clean tech, dirty tech routine. Now, some of our patients are immunosuppressed, and they're actually in a special room that is sealed and pressurized. When you're going to deal with those patients, like if you're going to somebody's room that's on reverse isolation, you have to be sure to clean everything really, really good before you go in there. So, don't take any disease into that room, because those patients are in kind of a dangerous situation. If they get exposed to a disease, they can wind up getting really, really sick. Okay, and we've already kind of talked about this. Airborne contact, droplet precautions. For airborne, you need an N95 or equivalent, like this one right here. These are the kind they use at the hospital. It's got like a little metal piece on the bridge of the nose to help you make a good seal. And everybody's supposed to have been size checked to make sure what size N95 mask you need. Some examples of airborne. Tuberculosis, chickenpox, and measles. But N95 can protect you from those. Okay, droplet precautions. Some, like viruses and bacteria, can live inside of like a drop of mucus or a drop of water. So with droplet precautions, you don't necessarily need that N95 mask. You just need something like a surgical mask, so that just in case the patient coughs in your face, this is going to protect you from those droplets. And some examples here are rubella, mumps, and flu. Those are examples of diseases that travel via droplet. And then contact precautions. This is like if a patient has an open wound, then we're going to be careful. We're going to wear gloves and a gown. You don't necessarily have to wear a mask. Okay, and some contact precautions. Skin infections, people that have staph infections. Staph, even if it's not MRSA, if it's just plain old staph, it's still very infectious. Scabies, you can if somebody's got scabies, if you look at them sideways, you can catch it. That stuff is very, very contagious. Herpes is contagious. That's another one of those things that, like, if you get it on your hands and then you rub your mouth or your lips, then you can wind up getting like a simple herpes infection. And the C. diff, be careful. If your patient has diarrhea, it's entirely possible that they have C. difficile, and that stuff is hard to kill. Alcohol gel like Purell doesn't really do anything to C. diff. You have to wash it off with soap and water. So be careful and keep yourself clean. And conjunctivitis is also known as pink eye. It's very, very contagious. And here's a little chart, with some different diseases and the precautions that you need to take whenever you're possibly going to be exposed to these. Make sure you know these things. Superbugs. These things are basically just all resistant to antibiotics. MRSA, we've talked about, VRE, C. diff. This CRKP, I'm not 100% sure how to pronounce this thing. I'd have to go through it, pronounce it phonetically. But it's also called CRE, so a lot of times you'll see it abbreviated as such. CRE is another one of these bacteria that's just hard to kill. It can be cured, but you just have to have it's immune to most penicillin type drugs. Okay, the body's defenses. As long as your skin is intact, you should be good. Keep your skin intact. If you've got a cut on your skin, be sure to put something over it, like a piece of Tegaderm or something, to protect that cut, especially if it's on your hands. Your mucous membranes are pretty good at repelling any kind of invading organism. Your mucous membranes are going to try to sweep it out. There again, unless you're somehow compromised. The cilia are part of your throat and the lining of the trachea and the inside of your lungs. What those are is just like little hairs that are constantly sweeping mucus out of your body and sweeping particles out with it. And when you cough, when you sneeze, that's another way your body has of blowing invading particles out. So if you feel a sneeze coming on, don't stifle that. Your body's trying to get rid of something. Just sneeze into your arm or, into a napkin or something like that. Now, if you've got a fever, that's your body's effort to basically turn the heat up to the point that the bacteria or virus can no longer survive. Most bacteria and viruses can only survive in a very narrow temperature band. So if your body's temperature gets up to like 102, it makes it easier for your body to kill those diseases because they're going to die from the heat anyways. And then antibodies, of course. These are things that your body produces in conjunction with your white blood cells. These are proteins that help mark and or destroy invading organisms. Appendix, I'm not going to read all this to you. If you would, whenever you get a chance, go take a look at the PowerPoint presentation that's on Blackboard. There's a lot of good information here, but it's really dense. I'm not going to read it to you. Good advice right here. Keep yourself clean, healthy, well rested, and hydrated. And use your PPE always, even if a patient doesn't look sick. Okay, here's some information on MRSA. Causes of MRSA. It turns out that there's like hospital-acquired and community-acquired. Community-acquired MRSA is just, people out in the community infecting one another. Here's some information on C. diff, Clostridium difficile. And if this stuff gets in your intestinal system, you're going to have a bad day. It causes all kinds of sickness, a lot of vomiting, a lot of diarrhea. It can be life-threatening. It can cause like severe dehydration. Here's some more symptoms of C. diff. Why does C. diff overgrow? Several different reasons. You guys can read all about it. And then here's some more information on CRE. Just keep in mind the CRE is a bacteria and it's just really hard to kill. Some pathogenic fungi. Yeast. Y'all might have heard of Candida. This is a pretty common yeast infection. It can get into your mouth, like it can infect your tongue and your throat, and the vagina. Mold, aspergillus. And here's some more information on fungi. And that basically is the end of my PowerPoint presentation. I'm sorry that took so long. Like I said, I wasn't sure if we'd get to go over all this in class or not, so I didn't want you guys to be hanging, just in case we run out of time on Monday.